Hi, this is Charles Feldman, and welcome to another episode of SOS America. And for those of you who may be watching or listening for the very first time, what exactly is SOS America? Well, it is a podcast about all the things that are happening in this country right now. And they are many. They are disturbing to many, but also many people find it exhilarating. It depends which side of the political aisle, I suppose, you're on. But the podcast is also aimed at people overseas, people who have questions about what might be happening here in the United States, politically, economically, socially, and are trying to decide whether they either want to be a tourist here, do business here, perhaps send a child here to be educated. So we have a wide variety of things to talk about, a wide variety of guests so far, and that includes the guest for this episode. So I'd like to welcome to SOS America, Dr. Monica Gandhi. Doctor, thank you for being with us.
Thank you.
Let me start off by asking you, as I've done with other guests, to just tell our viewers and listeners a little bit about yourself, and then we will launch into what I hope will be, and well, actually, what I know will be a very exhilarating conversation. Go ahead.
Yeah, so I'm an infectious disease doctor and professor of medicine at UCSF. I've actually been a longstanding HIV doctor, direct a medical clinic for low-income people living with HIV. During the COVID pandemic, I actually spent quite a bit of time talking to the news, talking to media about COVID. I think I had a kind of more nuanced response to COVID, very pro-vaccine, was talked about masks at the beginning, but then when we got into the vaccine phase, I really wanted that to be our key out of the pandemic. And so during that time, I think I maybe got recognized more because I was in the news. And then after COVID was done, went back to being an HIV doctor and being an NIH-funded researcher. And then now that the administration has started, lots of changes in science and medicine.
Okay, and thank you for that. And that actually sets up, I think, the beginnings of our conversation when you talk about lots of changes, and there have been a lot of changes, and we'll drill down a bit into that over the next few minutes. In a broad sense, though, when you talk about changes, some people would go, well, things always change. Change is good, right? You don't want things to be static all the time. But I think you mean changes in a pejorative sense, if I'm correct. So can you expand on that?
Yes, I definitely thought that our public health institutions needed reform. I thought that during the COVID pandemic, we actually didn't have kind of a nuanced look at it. We didn't have a variety of opinions. We didn't have policymakers helping to make decisions along with some of the heads of the current institutes that we have, like CDC, FDA, NIH. However, what's been happening since the Trump administration started is that you can argue that some institutions are not just changing, but they're massively kind of swung to the right politically. Like, for example, a good example is terminating grants at the NIH based on ideology. That's just as political as what happened during the pandemic, maybe more so. And
And let me just, for the benefit of people who might not be familiar with all the letters, when you say NIH, we're talking about the National Institutes of Health, right?
Yes, so the National Institutes of Health is the premier biomedical research agency funder in the world. I would say that the NIH has very little that Americans don't like about it. Then why I say that is that, for example, 361 out of 365 drugs that have been approved in this country from 2010 to 2019 were all as a result of NIH-funded research. It is life-saving. It is the NIH has improved the lives of Americans, extended lifespans. And if we lump in the NIH and just say everything's political during COVID, so we have to massively change it, and in some instances burn things to the ground, which is different than change. Then what we've done is we've halted research at a lot of universities, and that's what's happened since this new administration with the NIH. Harvard's getting no money, Western's getting no grants, Brown, UCLA now, Duke, Columbia, like just research is stopped. And what that happens, that's not reform, that's burning to the ground. And when you stop research, you stop cancer research, Alzheimer's research, diabetes research, things that Americans care about. Yes, we can improve our food supply. We can improve the sugars and dyes in our food, but that is actually not going to make the same difference that a novel cancer vaccine is going to make. And that only can come out of the NIH.
Sure. And these changes that you're talking about at the NIH here, correct me if I'm wrong, also have an impact on people outside the United States. I mean, you don't have to be an American citizen or live here even to benefit from some of what the NIH does or did. Am I right about that?
That is absolutely true. Actually, NIH is such the premier research agency in the world that it is, I think, massively improved the health of the planet. So anything that happens here can go abroad, and but also importantly, vice versa. We can do research more quickly, NIH-funded research, for example, in HIV, in a place that has a high burden of HIV, like South Africa, and then bring that research back here and improve the lives of Americans. And we could do it really efficiently. Actually, the NIH has stopped all new research in South Africa, likely because Musk was, with us at the beginning of the Trump administration. I mean, just these are arbitrary decisions, right? Like Elon Musk from South Africa doesn't like South Africa. South Africa research doesn't get funded. These are not measured, rational reform. These are destructive, arbitrary, capricious decisions.
To what end do you think?
I have been staying up nights for the last 7 months trying to think for what end, because it seems like, for example, terminating grants, stopping research, seems arbitrary to me, seems very destructive to me. And I don't see the point of it, and actually wastes taxpayer dollars because, for example, when we terminate grants at the NIH, a judge said, nope, you can't terminate them. You have to put them back. Now, all that waste of taxpayers' money, they're putting them back, these grants that were terminated on DEI, for example, or having the word gender in them. So, to what end? I think chaos could be part of the point. Chaos is really antithetical to science. Science is very methodical, rational, needs ongoing funding, ongoing steadiness, participants in clinical trials, not being going back and forth if it's going to stop or not. So I think chaos could put a wrench in kind of really in people's hearts actually and discourage them from doing science. People have absolutely left universities, especially young investigators who are like, this is not working, the NIH is not working. And that's how our research institutes are funded. I'm going to go to industry or go look elsewhere, leave the country. So it could be chaos is discouraging to the process of science. And a lot of what's happening in the administration, to me, not just in science, seems very chaotic. And that leads to a sense of feeling discouraged and also out of control.
Can you talk a little bit about the impact on you directly? Because we've been talking so far about a kind of broader impact, but what about on what you do? How has it had a direct impact on you and perhaps on the patients that you see?
So am an infectious disease doctor, but my identity within infectious disease is an HIV doctor. And I always call HIV sort of a movement in the sense that we all work very closely together. Clinicians, researchers, patients, people living with HIV, advocates, non-governmental organizations. It's a really connected group. And HIV feels particularly targeted. And why do I say that? Because the word even gender, transgender individuals are actually at higher risk of HIV in this country and worldwide than people who are not transgender. So attacking the word gender. And January 20th, there was a executive order put out by the president saying there's no such thing as gender. But that isn't true. There is. And so attacking the word gender attacks the HIV movement. And then also the second is diversity, equity, and inclusion. Also, January 20th, executive order put out by the administration saying that diversity and talking about diversity is prejudice. But the problem is that again, actually people living with HIV, it's a very diverse population here in the United States. So because of that, HIV has been particularly affected by these executive orders. And what that means is I see patients who are low income and they're very diverse. They are Black, they are Hispanic, they are immigrants. They're all low income because that's the clinic population we serve. Various effects have been that we can no longer provide gender affirming care because that federal funding was all cut. People who are immigrants are not coming into care, especially at the beginning of the administration, because there was a Homeland Security change that said that you could actually come into hospitals and find undocumented immigrants. And so people stopped coming into care. And then the third is Medicaid cuts, which were passed by that big bill, though they haven't been enacted yet. That is extremely concerning because our 100% of our population is on Medicaid, and around the country, 40% of people living with HIV are on Medicaid. So no doubt this group of people living with HIV or at risk for HIV are affected. And then worldwide PEPFAR and other programs that have improved the lives of people living with HIV worldwide have been cut or hobbled, including USAID. So it feels particular to HIV, or it feels that HIV has gotten sort of the brunt of policies that this administration doesn't like the populations living with HIV.
Will these changes translate into people dying?
Yes. In fact, I think worldwide there's a very easy way to look at the impact. It's called the PEPFAR Impact Tracker. All you have to do is put that into Google, and it's a modeling that shows how many people have died of AIDS, excess deaths, since the start of this administration. It was specifically since January 24th, when which was the Friday of after the inauguration, when PEPFAR was um, it was hurt essentially. PEPFAR is the President's Emergency Plan for AIDS Relief put into place by G.W. Bush in 2003. It's been life-saving. 26 million people have absolutely been saved by this incredible program that Americans have supported. And if you go into PEPFAR Impact Tracker, you can see that about 80,000 people have died around the world of AIDS, adults, and about 7,500 children since the beginning of this administration, excess deaths, because of all the cuts to global aid, basically, USAID and PEPFAR.
Let's also talk about another sort of interesting, and I'm using interesting in in a kind of an ironic way, I suppose, interesting aspect of what is happening now with the current administration in Washington, the Trump administration, and the world of medicine, and that has to do with these messenger RNA vaccines. And, I probably have a better understanding than most people because I was actually in the Pfizer COVID vaccine trial.
Oh, good for you.
Yeah,
That's great. Yeah.
well, I got to tell you, I mean, about half the people I know thought it was a dumb idea to volunteer, and the other half thought it was a good idea. I just thought it would be interesting to do. So I was in that trial for the what became the Pfizer COVID vaccine. I was in the placebo group though, and then when they found out it worked, I got a call one day and they said, "Oh, you were in the placebo, but you can come in tomorrow now ethically because we know it works and get the actual vaccine." So I got it pretty early on. And I actually do remember sort of half joking to the trial doctor. I said, "Oh, so I was kind of in the group that you hope would die to prove that the vaccine worked." And he didn't
Very
deny
interesting
that.
question. Yeah. 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 It's a very good question because we can talk about the idea of placebo control too. But yeah.
Yeah.
Yeah. Yeah, right.
but here's where I'm going with
Yeah,
that, doctor. Where I'm going with that is so I was in that trial. I then got the vaccine. I've gotten the boosters all along. I've so far been fine. I've had COVID a few times, but very minor cases, and I do attribute that to the fact that I had been vaccinated. But now, as you know, the word has gotten out from the current administration to no longer fund ongoing research into messenger RNA vaccines, which have applications beyond the use for COVID, right?
right.
So I'm going to ask you in sort of lay person's terms to explain to people what the heck a messenger RNA vaccine is in the first place, and why is it even controversial?
Yeah, so mRNA vaccines, messenger RNA vaccines, were actually not developed for the first time during COVID. They started being developed during what was called the MERS pandemic. This was a Middle East respiratory syndrome, but it was another coronavirus, just like SARS-CoV-2, that caused severe disease. We've had this century alone three coronaviruses that caused people to be hospitalized and die, unfortunately. And one was SARS, the first one, 2002, one was MERS. 2011, one was SARS-CoV-2, this latest one that we all lived through. And, MERS, they started developing this new technology, this mRNA vaccine technology. And the idea is that actually any vaccine is just a piece of the virus. They all simulate natural immunity. You either put a piece of the protein of the virus or you put the whole virus, but it's killed or inactivated in some way into the human body, linking it maybe to an adjuvant, something that makes it work better. And then you develop an immune response and you go about your day. You've just gotten immunity from the vaccine as opposed to being exposed to, say, a dangerous virus. But what the mRNA vaccine does is it doesn't put the protein, what's called the spike protein, into your body. It actually puts the messenger, the way to that your body produces the protein. It's called
Mhm.
the messenger RNA. And then you yourself say, oh, I see this mRNA. I'm going to make the protein that looks like the spike protein of the virus, and then you raise an immune response against that
So is it kind of
protein.
to not be
The
overly
blueprint.
simplistic,
Yeah.
but to not be overly simplistic, is it kind of like putting a computer code into a computer to instruct it what to do? Is that kind of what it
That's
is?
perfect. Yeah, that's a perfect example because anything that we use for genetic material, we always call this word code. So that's exactly right. You put in the code, then you make the material, you spit out the product, which is the spike protein. Then your body sees the spike protein and they say, "Oh, I'm going to raise T cells, B cells, antibodies. This is foreign to me." And then you're suddenly immune against a COVID. Now, the important thing is you didn't become immune against all COVID infections. Like you just said, you got to COVID twice during this time, but
Oh, three
you
times.
become three times. So
Three
no
times.
doubt you can't prevent all infections.
Yeah.
That actually has to do with antibodies in your nose, but you will stop severe disease. And that was the entire point because we never would have developed a vaccine against the common cold. Don't have time, don't need to. Essentially, you're just trying to prevent severe disease, which of course this killed 7 million people, the COVID virus. So it's a terrible disease. So we needed a vaccine. And what happened is Trump started in the first administration Operation Warp Speed. And he really needs to be credited for the development of the mRNA vaccine for the COVID virus, SARS-CoV-2, and took credit actually, meaning was, got vaccinated himself, got
Yeah.
boosted, stopped talking about it after he didn't win the 2020 election, but he absolutely got vaccinated. And we had to give him credit that that was, that private public partnership really worked quickly. And why is this a good vaccine? Because number one, you can change it quickly, which is just easier to do than with a vaccine that doesn't have the code. It just takes a long time. And also, it can raise such a strong immune response even in people who are immunocompromised. So I was really grateful for it for my then 88, 87, now 90-year-old father, because I knew that he would raise a strong immune response, even though the immunity does go down with time, just being older. So it was a good vaccine, and it's developed under Trump, and stopping it now doesn't make sense to me. But I will say that it got a lot of controversy attached to it. And why did it get controversy attached to it? Well, the main part of the reason was that it did have some side effects, and I think those side effects were overblown. So, for example, it could cause heart inflammation in young men. All we had to do was space out the dose, and that actually didn't occur in young men. And it didn't mass kill people, but it got taken by some people who didn't have, I think, scientific information and said it was mass killing people. That actually wasn't accurate. It actually saved a lot of lives. In fact, there's just a piece last week by Dr. John Ioannidis in JAMA Health Forum, and he got a lot of flack during the COVID pandemic because he was really nuanced about school openings, like I was, and other
Yeah.
people. But he showed that he modeled that the COVID vaccine, that mRNA vaccine, saved 2.5 million lives. And so he just published that like a week before this interesting decision by the HHS secretary, given that he was kind of on the side of having a more nuanced view of COVID, but saying that the vaccine saved lives. He really is a great scientist and he was able to show that. So it absolutely saved lives. No doubt. I actually wrote a commentary for that piece. But it got controversy attached to it because of side effects that were not causing the mass deaths that they that people claimed. That was incorrect information. Second is that we weren't that nuanced during the COVID pandemic, and I get to blame public health for not pushing boosters on everyone instead of on people who needed it the most, who are older people. Younger people didn't need it as much as older people, and that's how the rest of the world did it. They said older people need boosters, and this country said everyone needed boosters, and that made public health look like they were out of step with
Yes,
the rest.
but wasn't if there was a sort of original sin on that created this controversy with the COVID vaccine and by extension, of course, now messenger RNA vaccines. Uh, wasn't it really that in the beginning, because it was new and because COVID was new, I'm talking about now, not necessarily the vaccine, but COVID itself, that the government did uh, overpromise. I mean, there was this sense, because I remember when the vaccine finally came out, uh, the word was get the vaccine, you won't get COVID. And I remember when all of a sudden, not one, but two, four, 10, 100 people started to come down with COVID, even after being vaccinated. It became a huge news story at the time because people were scratching their heads going, we don't get it. These people were vaccinated and they still got COVID. And it turned out that the vaccine, is good for a few months at preventing infection, but thereafter, it does kind of wane in that sense, although its ability to prevent severe illness goes on for quite some time. Am I wrong about that, or
No,
wasn't
you're
that what
abs
set it all up as making people question it?
yes. You're okay. So you're absolutely right that, again, I want to blame two problems. I want to say that there were two problems with the vaccine. One is that there was misinformation about it, but the second absolutely is that public health officials did not do a great job at all messaging kind of the nuances of immunity and the immune response. So what happened at the beginning when people got the mRNA vaccine is that it absolutely did stop infections for a while, and then it stopped working in that way. And it's super simple. It actually has to do with the immune system. You get antibodies in your nose. They're called IgA, and they come down with time. And then you can get infected again because the nose is the major place where you imbibe a virus. But the T cells, B cells, these are what's called cellular immunity, is still in your body, and they're going to still prevent severe disease. And it involves knowing the immune system to be able to message better. And instead of saying at the beginning that, yes, it's stopping transmission now, but we don't expect that to keep on occurring, they said it stops all transmission. And then in June of 2021, when the Delta variant came, um, there was a lot of new infections, like in Provincetown, for example, during the P-Town gatherings, and everyone and public health officials acted surprised, which if they kind of really knew the T cells and B cells and antibodies, they wouldn't have been so surprised. And I spent this inordinate amount of time talking about T cells during the pandemic. But so I would say that you're right. It was two problems. That one was misinformation that isn't true, and the second was public health officials not talking about science as a changing phenomenon, that things
Mm.
change over time, that we get new data, maybe not knowing that the immune system as deeply as they should. And so those two problems came about and converged on the mRNA vaccine, and now it's gotten this reputation. Now, I will say that I do agree with the HHS secretary that we should have a variety of
Who
vaccines.
is Robert Kennedy Jr., we
John
should.
R. Kennedy Jr., that we should
Yeah.
have a variety of vaccine platforms for any infection. And the reason I would say that is India, for example, chose to have the mRNA vaccine, the DNA vaccine. They had whole virus vaccines. They gave their population a choice, and they had great rates of vaccination. So I think a variety of vaccine platforms is always a good idea. It helps people feel like they have choice, and we could have done that in this country. But it doesn't mean you eliminate the mRNA vaccine. The mRNA vaccine has great promise for quickly being developed for the next pandemic. If we got bird flu, we would want mRNA vaccines to do it first, and then we can maybe take some more time and spend with other vaccines. Second is that they can change quickly, you can modify them quickly. And third is that they have a lot of promise for other respiratory viruses and also cancer. So you don't want to just eliminate entire platform because no one did COVID right. I just think let's just look at the data and be clear, sober, data-based about our decision making.
So what happens now? If the research on this type of vaccine, which as you point out, it goes beyond COVID, because a lot of people at this point they go, oh, COVID, that's yesterday's news. That's incorrect, I think, in their thinking, but many people think that. But as you pointed out, there's the promise of treatments for a host of other infectious diseases, for cancer as well. So if you stop that research, or at least stop funding that research here in the United States, what happens? Does this mean that messenger RNA vaccines they're done, or do other countries have to pick up that slack? And which countries? Who has the money?
Well, this is a very important question because you'll see in Congress people are arguing about their concern that other countries are going to, take over the medical research enterprise when we stop things on more sort of in a capricious way. And China comes to mind and comes to Congress's lips. For example, Susan Collins, the Republican senator from Maine, is very concerned about China taking over novel technologies that could really help the planet. Obviously we diplomatically are supposedly not friends with China, so the question about global diplomacy comes into play here. But certainly, there's no way that mRNA technology is going away because it can make really a really strong immune response. And because of that, there's really hope for example, HIV vaccines, cancer vaccines, and also that in the next pandemic, they are going to be deployed quickly to get people safe while we're say making other vaccine candidates. So other countries will take it up. No doubt, private companies in this country will still develop it, and not with any public funding if this decision holds that RFK Jr. put into place this week, and also other countries like Europe and China. So no doubt, it's not going to ever go away. It won the Nobel Prize. mRNA technology won the Nobel Prize in 2023. People aren't going to abandon this technology just because the US is.
But do you think that COVID and the controversy about this particular kind of vaccine, the messenger RNA vaccine, has that, from your own experience, uh, brought about a sizable percentage of the population that is not only suspicious of science, but even suspicious of medicine? And in the past, as you know, when polling was done about, who people trusted the most and who they trusted the least, people in Congress always polled very, very low. People in my profession, journalism, have always, at least in recent years, polled very low. But physicians, medicine has always polled pretty high in terms of public esteem. But it sounds like there's now this, I think, troubling development where people are not only questioning science, but if you go to your doctor, and a doctor, after all, everything a doctor does has to be based on science. Well, if you question science, by definition, you also question the doctor, and maybe it's good, maybe it's bad. I don't know. What do you think?
No, I have talked a lot about this during the pandemic that I think the medical profession and scientists lost trust. There's no doubt. And I think we had kind of a heavy-handed approach during COVID where, for example, say business owners would say, I can't lock down my business. I'm going to lose everything. And public health would say, this is the only thing that's going on is COVID, and we're going to lock down your business. And unfortunately, there wasn't kind of this, what I call a harm reduction approach to the virus, where we take societal and individual needs into account while we're deciding on our COVID responses. So I completely agree that public health and scientists lost trust. The question is, at this point, um, how do you regain trust?
Hmm.
And I think that regaining trust is not going political the other way. It is not saying that, for example, the head of the CDC during the COVID response got to make all the decisions. It was just one way. And now the RFK Jr. gets to make all the decisions right now. That's in no way like having a kind of group of people, policymakers, people with nuanced views, different views of science, making decisions that are good for the American public. And when you, for example, poll Americans right now and say, let's decide if they ask one question versus not. If you poll them all and they say, did you like what happened during COVID? Did you like the NIH during COVID? People may say no. They may say, I didn't like that it just seemed that it was top down, that it was
Mhm.
obfuscating. If you write to Americans right now and say, do you want life-saving medical research that saves the lives of your families and loved ones? They will say yes. So it really depends on how you ask the question. And again, cutting federal cuts that cut indiscriminately and capriciously medical research funding is not going to gain back trust. It is not going to gain back trust. What gains back trust is people talking with nuance, people acting like Americans aren't dumb, which they're not. Don't talk down to them. Don't say, take the vaccine or you'll be fired. That's a talking down way to talk. Instead, say, let me tell you about the vaccine and let me tell you about, what T cell immunity does and why it would help you. Let me just tell you about it. Instead of being coercive, do education. We made mistakes. There was more coercive than I thought it would be in this country, how public health officials talked. But that does not mean that you go swing the other way and you massively cut life-saving programs for Americans. That doesn't help.
I'm curious. There are some academics in different professions who have left universities in the US to do their work in places like Canada, UK, France. Now, these are not medical professionals, but I am wondering if that is, to your knowledge, something that is now also touching your profession. Are there medical doctors who in this country have decided enough's enough, we can't do what we want to do, and have the free reign that we used to have, and are looking to go elsewhere? Is that happening?
Well, it actually takes quite a bit of retraining to go to another country. So doctors are not necessarily leaving the country yet. Some of them are retiring now. Like anyone
Ah,
who's kind of older, they're like, it's time. And
time to
why?
play golf. Time to
Yes.
play golf. Yes.
Well, because, and I think there's a lot of worry about the Medicaid cuts and the Medicare questions. So the Medicaid bill, the bill is proposing to cut $1 trillion from Medicaid. And
Let
what's,
me just interrupt for a second
yeah.
so that anybody listening or watching outside the US so that they know what we're talking about. So Medicare is a system that provides medical care. It's a government run, although there's a private element too, I suppose. But that's mostly for people 65 and over, but also younger people who have certain kind of disabilities. Medicaid is a joint venture between the federal government and state governments, and that supplies medical care for people who economically cannot afford private health insurance or can't work and that sort of thing. I think I got that right, right?
Yes, exactly right. And then
Okay.
Medicaid, though it does provide a care for those who are low income, it also provides care for older people in nursing homes because that's a very
Yeah.
expensive time, and also actually supports labor and delivery because that's very expensive even for people who are high income. So the question about, there's one thing that, you're watching these Republican constituents going home during recess and they're getting yelled at by their constituents, sorry, Republican congressmen, congresspeople, because I think that's just fundamentally healthcare seems like to the American people sort of a right, and healthcare is important. I mean, the reason the HHS budget is high is because we all get sick, we all unfortunately pass, and it just healthcare means a lot to Americans. So I don't think that the American people thought that this administration was going to really cut healthcare too much. Absolutely, they wanted, I think, cuts in federal spending. I think if you polled a lot of Americans, they may say maybe the military. But I think that the idea that it could hit close to home with healthcare was that's I think the polls are sort of shifting the other way. No one likes the idea of their healthcare being taken away. So I think that doctors are going to find it really harder to help people during with a lot of Medicaid cuts because you actually have to help them in the emergency room. If someone comes in bleeding with their, arm severely hurt in the emergency room, you have to take care of them. It's like absolutely the Hippocratic Oath. And so that's just going to end up costing Americans more to do emergency care because they didn't have preventative care. So it just never makes sense not to support the healthcare of individuals in a country. That's why so many other countries, almost every country around the planet has universal healthcare. So I think it's going to really hurt doctors, but it's going to hurt really people, American people more than doctors, when the Medicaid cuts come about. So I just think hurting the poor never helps a country. It's not very specific to a specific party. I think the working class a lot voted for Trump because the Democrats were not helping the working class. Then they'll go and vote for the Democrats. If they say they'll vote for the working class, it just is going to be a pendulum. You just got to help the poor of a country. You got to help disabled people. You have to help people who are poor. You have to help people with medical conditions. It feels very basic, fundamental rights.
Dr. Monica Gandhi, thank you very much for taking part in this episode of SOS America. And for those who are watching or listening, certainly if you have any comments, we welcome them. If you like the podcast, by all means, subscribe. It's totally free. Until the next episode of SOS America, thank you very much. I'm Charles Feldman.